Welcome to the show Talk with Your Doc. I'm Dr. Prashant Tijani and we are talking with Dr. Nicholas Escott about the cervical cancer. And we talked about various risk factors for the cervical cancer, and you mentioned that early sexual intercourse or having multiple sexual partners, smoking and family history as a risk factor. And we were talking about human papillomavirus infection. Please tell us what other cancers can be caused by HPV virus.
Well, if we just talk about the cancer-causing types, which are the 14 types I mentioned before, they can also cause vulvar cancer in women.
Yes.
And anal cancer in men and women. And just in the last few years, we've noticed that many cancers in the oral cavity or in the mouth and throat are actually associated with these high-risk types of HPV.
So human papillomavirus, which is type 16 and 18, which are high risk, can cause cervical cancer, vaginal cancer, vulvar cancer, anal cancer, and oral cancer.
Yes.
And this is a virus which is causing a cancer, and we can prevent it and by having some sort of a vaccination, right? So please tell us about something about the HPV vaccine.
About 10 or 15 years ago, a vaccine was developed against 4 types of HPV in order to try and reduce the risk of 2 things, cervical cancer and genital warts. Now, genital warts are also caused by HPV, but by different types than the ones that cause cervical cancer. Genital warts are caused by types 6 and 11.
Okay.
And the vaccine that was originally marketed was against all 4 of these types. 16 and 18 for cervical cancer, 6 and 11 for genital warts.
So who gets this vaccine?
Any woman can get it, any man can get it, but there's also a school program now that offers vaccination to girls and now boys in grade 7.
So as early as age grade 7, which is like age about 12 years of age, can get the HPV vaccine.
Yes, they can, at school for free.
So is that girls only or boys can also get the vaccine?
This year, it used to be girls only in grade 8 up until this year. And this year it's open to also to boys, and it's been moved back to grade 7.
So now how many doses of vaccine one needs to take?
The recommendation is for 3 doses over a period of 6 months.
Right.
There's new evidence that seems to show that probably 2 doses is adequate. So we might be switching to 2, but that remains to be seen.
So age 12 onwards, we can get HPV vaccine and 2 doses of vaccine 6 to 12 months apart. Can this vaccine be taken by adults or the grown-ups?
Sure. This vaccine has been validated in women up to age 45.
Okay.
And in men up to age 26.
So how many doses they have to take?
Same thing.
Same, 3 doses.
3 doses.
Okay. So this HPV vaccine, once we take it, it can prevent oral cancer, genital cancer, cervical cancer, anal cancer. So many cancers can be prevented by this vaccination.
Now, just up until the last 2 years, this vaccine was only against the 4 types I mentioned. So it would prevent cervical cancer caused, or these types of cancers caused by those 2 types, 16 and 18, and it would prevent genital warts. Now there's a new vaccine that's now being given instead of the quadrivalent or 4 type vaccine. It's called a nonavalent vaccine. It's against 9 HPV types, including 6 and 11, the genital wart types.
Is there any side effects of this vaccine? Can the vaccine itself can cause disease? Is it safe?
The vaccine is safe. It's as safe as any other vaccination. There's usually a little bit of discomfort or pain at the injection site.
Right.
And any severe side effects are extremely rare and no more common than with regular vaccinations for the flu or for pneumococcal vaccine.
And the vaccine is free in Canada, or you have to pay for the vaccine?
It's only free in school in grade 7. After that, you have to pay for it, or a lot of drug plans will pay for it.
Okay. Now, once somebody gets the infection, HPV infection, how can we detect it at an earlier stage that somebody has HPV infection?
Well, currently we can screen people with an HPV virus test by taking the swab from the cervix.
Cervical smear. Yeah.
But we don't do that because it's not covered by the Ontario Health Insurance Plan. It costs about $90, and at the present time, we don't screen people with HPV. We only screen women with a Pap test.
Pap test, yes.
And we don't screen men at all.
So Pap test can detect HPV infection in cervix at earlier stage.
Yes.
So who gets the Pap test? What stage, what age one should get the Pap test done?
In Ontario, we have very specific guidelines. Women, once they reach the age of 21, should start getting Pap tests. They don't need to get one before age 21.
Okay.
And once they start at age 21, as long as their Pap tests are normal, then they should get a Pap test every 3 years.
So 21 and then every 3 years Pap test.
That's right.
Now, somebody who has the sexual activity earlier age, like say 16, 15, do they get the Pap test done earlier? Is that an indication?
Not anymore. That used to be an indication, not anymore. And that's because the chances of girls getting cancer in that around the age of 20 are infinitesimal, so small that it's not worth it.
Please tell us how this Pap test is being done. What is the exact procedure of the Pap smear testing?
The Pap test has to be done in a doctor's or nurse practitioner's office, and a little instrument called a speculum or spreader is inserted in the vagina so that the doctor or nurse can actually visualize the cervix.
So it's not an invasive procedure?
Not really. It's uncomfortable for the women, obviously.
Okay.
But it's not invasive, such as say a needle biopsy or something of that sort.
So just a swab is taken from the cervix?
That's all it is. Just a little brush samples the cells on the surface of the cervix, and that goes to the lab and gets analyzed.
So other than this cervical smear testing, what are the other tests we can do to detect the cervical cancer at the earlier stage?
The Pap test is just a screening test.
Right.
So there are false positives and false negatives.
Right.
And depending on the degree of abnormality on the Pap test, those women might be immediately referred for a procedure called colposcopy, which is a more exact examination of the cervix, or they might be asked to come back for a 6-month follow-up Pap test from their doctor or nurse practitioner if they've got some minor changes on their Pap test.
Thank you, Dr. Escott. Please stay back and we'll come back with a short break.